Well, wanted to welcome Dr. Hesham Hasabala, one of our program medical directors for the tele ICU and critical care team here at Sound, and then also share with him really quickly what this meeting is. So once a month, this is our critical care crew in the clinician services privileging department. As we've grown, we've designated a monthly meeting so we could get together, talk about all things critical care in the privileging space. So these are majority, not all, but majority of the individuals, Dr. Hasabali, that support you and your team in the wonderful world of privileging, getting new privileges, keeping privileges, reappointed. This is the group that supports you. So we like to invite special guests. So today that is you. One, just to continue to foster those relationships with the field and the clinical team, but also for this team here to really give them additional context into the importance of what we do to help get you guys on site and at the bedside. So with that, I will turn it over to you if there's anything you wanted to add. If not, we've got a slew of questions to throw your way.
Oh, thank you. First, I do want to thank all of you. It's hard work. It's a lot of paperwork, a lot of back and forth, a lot of harassing clinicians, myself included in that group. So we can't do what we do without you. So I really appreciate each and every one of you, and I want to thank each and every one of you for putting up with us and and our slow responses and sometimes difficult behavior. And we definitely, on behalf of everybody, I think I can speak for them to say thank you so much for all that you do for us. We definitely can't do our jobs without you.
Thank you
Uh,
for that.
of course, absolutely. So I'm very happy to be here. I'm really honored that you chose me. And I think let's just go right into it. I'll begin with just an introduction of me. I am I'm Hesham Hasabala. I have been with Sound. This is my 12th year. I started in January of 2013. I am program medical director here at Rush in Aurora, the second largest city in Illinois. Our program here, I've been the program medical director for that program since 2013, and I am now an associate regional medical director overseeing programs in St. Louis and Delaware. I do both on-site critical care work. I'm on shift today, and I also do telemedicine as well. So I love being with Sound. I love my team, you guys included, and I'm very excited. And I think I just want this to be an interactive. Just throw the questions my way, and we'll make this a great discussion.
Awesome. Okay, so our first one, probably an easy one because you're literally doing it right now. What does a day in the life of a critical care physician look like?
Yes, so that's a great question. It depends on, obviously, if you're on site or if you're telemedicine, obviously, it's a little bit different. But, usually I come in the morning, um, make sure that there are no fires. So when I get on site, I make sure there's no fire that's waiting for me, because a lot of times there are crises that can happen right at shift change. And then I have to deal with it. Our program is one of the unique ones where there isn't a 24-hour intensivist presence, and it's been working fine. Most other places that have a 24-hour coverage will when I come on, I'll be getting sign out from my partner who covered the night shift, telling me what's going on, any new patients, that came in, any issues that I need to deal with right away. And then, or otherwise, I'll get a phone call or a text message from my partner that whatever happened overnight, and then I will deal with it. So I usually here in Rush and Aurora, I'll make sure that there's no fires going on, make sure everything is okay. Look at my patient list for the day. Go get my cup of coffee. Very important. It's the thing I definitely look forward to every day. And then I see all around on all the patients. I physically see all the patients that are in the ICU assigned to our care, make sure things are okay, look at all of their clinical information, and then start writing my documentation, starting writing my notes of what's happening, what's going on with them today, and then what I'm going to do about it for that day. Then here at 10 o'clock, and typically it's between 9 and 10, usually most programs will have what's called multidisciplinary rounds, where the intensivist, the charge nurse, the bedside nurse, case management, pharmacy, respiratory therapy, sometimes physical therapy, sometimes spiritual care, all get together, go from patient to patient, and go over the care in a comprehensive manner. It's one of our best practices at Sound Critical Care, and it's what we do every day on every patient, whether it's telemedicine or not, on site or remote. And it's just a way to make sure that we are caring for the patient in a comprehensive manner. We don't miss anything, and we invite families to join us on those rounds. They give us insight, they ask questions of the team, and they can see that it's really a big team that's caring for their patient. And so we do that. It takes about, I did rounds early so we can have this meeting today. Um, and then then I finished my documentation, and then I just kind of be around to follow up on things that we do or things that we order, speaking to new clinicians about their cases when they come in the ICU, and then see new patients that get admitted to the ICU. So that's the typical day. And then when the shift is over, the my relief comes in. I give handoff, tell them, here's what's going on with the patients I've seen today. Here's what I need you to do, and then we kind of go from there. And then that's kind of a typical day. And the only predictable thing about the ICU is that it's unpredictable. So I could be, sitting around, enjoying my time or doing whatever, and then a patient crisis happens, a patient suddenly deteriorates, someone suffers cardiac arrest on the floor, or something happens all of a sudden, and that just consumes the rest of my day or several hours. Many times these crises tend to occur at the end of the shift. Um, so and then it just takes up a lot of my time.
And about how many patients do you see on average per day?
So that varies. It can be anywhere. It could be as low as 5 or 6, or it could be upwards of 15, um, depending on the services.
Gotcha. And then we know there's a lot of different specialties, several of which we support at Sound coming out of medical school. But we were curious kind of where your desire to pursue critical care medicine came from.
I was thinking about that today, and I think I fell in love with critical care the moment I stepped into the ICU. It's I just love being an intensivist. I mean, I was very very fortunate, very blessed. I did really well in medical school. I really could have chosen any field I wanted to, assuming I would have gotten in. But the door was open for me. And sometimes when things are going tough, I sometimes wonder why I didn't do a nice, easy, cush outpatient specialty where I had my weekends and holidays off. At the same time, I really, really love being in the ICU. It's a fast-paced environment. You can see people very ill, deteriorating very quickly in your before your eyes, and you have to act quickly to try to save their life. And 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 you can see critical illness kind of unfold in a matter of hours before your eyes, and and be able to intervene and help people at their most vulnerable. I mean, I wanted to be a doctor because I want to help people. That's all I've always wanted to do. And in the ICU, you can help people very quickly. Um, and I love it. There's part of me that's a surgeon, and you get to do procedures, and I love that part of it. Um, and I don't mean to disparage other physician colleagues, um, and APP colleagues, but and at the same time, as an intensivist, I really feel I'm a doctor, a real doctor. And why I say that, I'm also a pulmonary specialist. I'm also a sleep specialist. So when I was a pulmonologist and seeing before I came to Sound, I was in private practice pulmonary medicine. I only focused on the lungs, right? I only looked at your lungs. I only cared about your lungs. If your lungs were good, I don't care what the rest of the body's doing. My job is to focus on your lungs, right? And but as an intensivist, I have to care about your lungs and your heart and your gut and your kidneys and your skin and your eyes and your brain. I really am a doctor. Like I can take. I'm a physician. I take care of the entire body. I have to understand how the different systems interact with each other to try to help manage critical illness. And so that's so fulfilling to me. And I really feel that I can do the most good for a patient who presents in their most dire hour. And I just love it. And when and to help someone beat, to help someone heal from critical illness, the feeling you get is unbelievable, right? People who literally were near death come back and say hello, and they look great and they feel great and they're very appreciative. That is oxygen for me, and that keeps me going for months and months and months. And when we can't have help someone conquer critical, or can't help someone conquer their critical illness, we can help mitigate suffering. To me, I'm a lay pastor, and it's almost minister. You can minister to the family, you can minister to the patient, and mitigate their suffering and help them get a good death. And to me, that's just as important, because the last thing I would want anyone to do is to suffer at the end of life. And
Right.
we are uniquely positioned to be able to mitigate suffering at the end of life and minister to the family and help them feel better. And that to me is just as satisfying. So, kind of, it really is just the best way I can be a doctor and give back for the tremendous blessing of being a healer.
That's a really good perspective, because I personally, as well as probably everyone on this call, would imagine, the unfortunate outcomes, have to be probably extremely difficult for you and your team to deal with on a daily or weekly basis. But I really like that perspective of, even when it's we can't fix it, we can still bring some peace, potentially, to that situation. So that's really fascinating. If you were forced to choose, or work in another medical specialty, what would it be?
That's hard. That's hard to say. I mean, I like being a lung specialist. I think it's not as it's not as um, high tech as the ICU, right? It's not as fast paced. And at the same time, the one thing I do miss is my pulmonary practice and my pulmonary patients. There's this very special bond that you make with your pulmonary patients. You help them breathe better, and that's huge, right? For a lot of
Yeah.
people, to help them breathe better, right? And so I remember when I announced my leaving my practice, coming to Sound. The last 2 weeks of my office were just filled with patients saying goodbye, right? And that I miss. So if I were to choose another specialty, it would be outpatient pulmonary medicine, because I really, really loved the bond I made with my patients. And I remember I would, you'd tell me a name and I'd know, oh yes, she needs this and she needs a CAT scan in 3 months and she has this and this. Now it's just, there's so many people, I can't keep them. I can't remember, right? And a lot of times I don't remember, unfortunately, and that's hurts a little bit. And but with my pulmonary patients, I knew everything about everybody as soon as you tell me their name. So that I miss, and I think one day that might be my off ramp from critical care, is into the outpatient pulmonary ward, and I really love doing that. Other
That's
than
awesome.
that, really, I really don't know if there's anything else I could do. I mean, and I thought about it hard. I thought about anesthesia. I thought about it, primary care. I thought about all the surgical subspecialties. There's just nothing that's as fulfilling. And when I have a tough day, uh, I still, at the end of the day, I'm walking out of the unit smiling, because I really enjoyed my time. I love being an intensivist.
That's awesome. Okay, so we know, if we have been personally or had a family member in the ICU, it's probably pretty scary, right? But we had posed a question to you: what is a positive story, you've had coming out of the ICU that really stuck with you?
That's a really good question. In fact, I'm looking to do a research and a survey, because when you ask a doctor, typically, what's the case you remember most? Almost always, it's a negative case. Like, we'll always remember the bad outcome, um, right? And I think I have 50 bad outcomes that I could tell you that really stuck with me. There was one case of a young gentleman who shot himself in the mouth accidentally with a pellet gun, or like a tear gas gun or something like that. And he was super sick. I mean, and I didn't think he was going to make it, and he did. And he came back, and I didn't recognize him, and he recognized me, and he was so appreciative. And he came back, and it was really good to see that he did. That he did good, and he's doing well, and we were able to help him. The other thing that I remember was actually a family member, a patient passed, he had COVID, he passed away, but the family member came back. I still have the pictures on my phone, and gave us like little thank you kits and little thank you packages, and gave me like a water bottle with my name on it. And she just came back just to say thank you, and thank you for helping my dad have a good death. And she heard that appreciation. That always, I always remember that, because you know I don't do this to get thanks, and it's good to be thanked, right? Because it's nice to know that what the things that you're doing day in, day out, do make an impact. Which is why I try as best I can to thank the people I work with, my team, you guys. I try to remember to thank my wife and my family and my kids as well. It's really nice to be appreciated, and having a family member appreciate you. I remember another patient with COVID who he passed away peacefully, and his wife sent a letter again, the just saying, thank you for giving him dignity at the time of his death. That that really that sustained me for years. And so it's not always a positive outcome. And if we can, and if I know that we've done good for the family or good for the patient, that's what's so important.
Yeah. Yeah. That's fantastic. Okay, we talked a lot about critical care. We'll throw one more question and then turn it over, see if anybody thought of any others. But what do you like to do with your time outside of the hospital?
So I love to play golf with my son. He's 11. He's going to turn 12 next month. So it's wonderful. When the kids were younger, I'd have to get up at 6 a.m. and play 9 holes and at 6 in the morning, so I can be home before the kids wake up. But now, with my son's older, it's father son time, and my wife never says no. So anytime I want to play golf, I just say, "Hey, can I take Zach?" My son's name is Zach. Golfing? Yep, it's fantastic. So I get my golf fix. My son gets to practice, and
Your wife gets the house to herself, right?
Yep,
So it's
yep, yep.
win-win.
And it's a win-win. And then I really enjoy playing golf with my son. I love writing. Writing has been always been catharsis for me. I have a newsletter on LinkedIn. I published a book called How Not to Kill Someone in the ICU. I published a book of fiction, self-published a book of fiction called Code Blue. Throughout the pandemic, throughout my daughter passed away 15 years ago from as complications from cancer. I wrote a ton about her, about the grief I felt and still feel. So writing, I love to do writing. I love podcast. Now I'm into podcasting, and I have a pod. I drop on my podcast Healthcare Musings once a week. And thank you for allowing me to record this to put on my podcast. And it's perfect for Critical Care Awareness Month. Um, though that's how I can cope. Listening to music on the way home. My you know I when my car is my university lecture hall. It's my dance hall. It's my club. It's my learning lab. I just that time between home and the hospital is home. That's where I stream YouTube or listen to music, where I learn things, learn about the world, practice, keep up on my French. I'm learning French. So um, those are the things that allowed me to cope, and it really helped, especially writing, and now podcasting has really helped me cope and deal with the things that we face uh, in the ICU. So that's what keeps me busy outside. And people wonder how is it that you're able to do all these things? Well, I don't. When I have idle time, I don't scroll through LinkedIn for 2 hours or TikTok or social media. I say, okay, this is the time I'm going to write my newsletter now, or I'm going to do the data analysis, or I'm going to do this. Idle time is a gift. So I use that time to record a podcast episode, or to write a newsletter, or write an article, or read up on something. That's that time. Just scrolling on social media, I try to keep up on LinkedIn and like and engage as much as I can. Probably not as much as I should, and that time is where I can use to get things done. So that when I in that way I can have time to myself.
I love it. Okay, I thought of one more thing. What's your favorite genre of music to listen to on your drive in or drive home?
Oh, so I have a hodgepodge. When I was growing up, I listened to a lot of hip hop, real hip hop, not the garbage that's that they call hip hop now.
He's
That had a
speaking my language,
story.
isn't he, guys? Everyone.
Yeah, yeah, yeah. A lot of '80s music. I'm a big Michael Jackson fan. I'm not sure if at our medical director summit, I was the um, entrant into the I was the critical care entrant into the talent show, and my talent was to lip sync to Michael Jackson, and I guess it was really well received. I'm a big Michael Jackson fan. Some old school hip hop, some '80s stuff. It's kind of a hodgepodge, and then there's some new stuff that is okay, right? I always screen it for the lyrics. People don't, as I'm a writer, so people don't pay attention to the lyrics. People write the lyrics for a reason, and they're like, oh, the music is good, but the lyrics may be poison. So I think I think we have to pay attention to what the songwriter is saying. There's the reason why the songwriter wrote the lyrics. There's a message to the song. If the music is good, that makes it even better. But if the message is toxic, everyone's worried about what we put in our mouths, but not so much what we look into our eyes and ears. And so I make sure that the lyrics are something that will uplift me and not push me down. And if the music is good, all the better.
Yeah,
So, it's I'm kind of like all over the place with
uh,
respect to my favorite music.
I like it. All right, this has been wonderful, and we've got a few more minutes. Did anybody think of any additional questions that you would like to ask Dr. Hasabala while we have his time?
Has your daughter figured out where and when we're having the wedding?
Yes. So now
Okay.
yeah. So my oldest is getting married this summer. It'll be July 15th, and so the venue is still to be TBD, but I think they did fix the date, and the planning has been. I'm not really involved in the planning. I just pay the bills. So but and I don't think I'd want to be involved in the planning.
That's probably the
So
easier part, just paying the
yeah,
bills,
yeah,
right?
yeah, just pay the bills. So, but I mean, it's very exciting. He's a really good guy, and I pray for the best for them.
Will that be local in where you're at in Chicago, or are they going
Uh,
somewhere else?
I will. Well, that's the TBD.
Oh,
We're
TBD.
trying to
Okay.
figure. Yeah, we're trying to figure that out.
Okay, got it. Anybody else have anything?
It is really good to see you guys. I know we're always on the phone together and everything, so it's nice to see you guys on video. And like I said, I just really thank you guys for all the hard work. I know it's a hard work. It's a lot of paperwork. It's a lot of things that you have to chase down, and we are not the best at responsiveness. So again, once again, I really like to thank you for all your hard work. I know it can be a challenge, and they make it difficult on purpose. All the stuff that we have to do. I mean, when every time I think about the I have to go. Oh my, I have to get the fingerprints. Oh my lord. I gotta go and get the fingerprints, and it's like annoying. And I gotta sign this, and I gotta sign it with ink, and I can't do it electronically. And it
It's
can
got to
be
be
annoying
blue
on our end.
ink.
Well, it has to be blue ink, not black
Right,
ink, because blue ink is better for some reason.
right.
It's annoying, and at the same time, I know it's absolutely critical, no pun intended, to
Yeah.
the job that we do. So again, I thank each and every one of you. We could not do our jobs. Literally, we could not do our jobs without you.
But we appreciate that very much. It is interesting, though. Amanda, myself, and Nancy attended a training here in Dallas. There's some changes going with the HM and EM model. So we did kind of a privileging overview for some new colleagues, and Amanda was referencing. We kind of hate talking about it, but it's kind of interesting. But the case of Dr. Death, which was a local surgeon here in Dallas Fort Worth, and some things that could have been put in place to prevent some of those issues that continue to happen. So it is a lot. I think, Amanda, you referenced it as the ultimate background check. But as somebody who's been a patient before, if your family's been a patient, having that understanding of what goes into it, okay, I'm being seen by somebody that's really skilled and going to take good care of me. So So yeah, we're happy to handle the paperwork piece for you guys. Also, just want to wrap up. If you have any feedback, specifically for the tele-ICU team, we know you're credentialed at 1 billion sites and licensed in multiple states. So we've been trying to condense the contacts that you guys work with and have as few reach outs as possible to help kind of keep that organized. But if you have any feedback ongoing, please don't hesitate to let us know. And thank you to you and your team as well. We're very, very appreciative that you chose to be an intensivist and take care of people that are probably coming to you in their worst state and helping get them back on track. So thank you as well.
Oh, absolutely. It's my pleasure. And like you said, Dr. Death, I listened to that podcast. It's very, very frightening. Patient safety is super important. What we do as, as department chairs to make sure that the people that we bring on staff are competent and they know what they're doing and they are skilled and they don't harm people. I mean, that is very noble. I think what you're doing it seems very mundane and annoying and boring, but really, really, truly what you're doing is you're ensuring that patients get safe care. It really is a noble task. It really is. It doesn't seem that way. And as department chair, when I have to credential someone new or I have to re-credential, the Department of Internal Medicine is probably the second largest department in the whole hospital, if not the largest. We got to make sure people are delivering safe care, that they know what they're doing, so they don't harm people. So really, really, you are in a noble, I would venture to say, holy quest to make sure that we know what we're doing and we do it the right way so we can take care of patients safely. So thank you.
Awesome. Well, it has been a pleasure. I've worked with you a long time, but really great getting to know you a little bit better. I will shoot over this recording to you. We're all looking forward to being famous on your podcast. So
I have to let you know. Let's. I think by you guys being here, it will jack up the fame. So thank you. shameless use of whatever I can to get more exposure. Thanks for allowing me to re-air this conversation. It's been wonderful. Thanks for having me. It's been an honor to be chosen. Thanks again.
Thanks, Dr. Hasbala. And everyone else will stand just for 1 second, and we're going to do our picture. Thank you. Bye-bye.
Take care.
Cool. Thanks for joining, Amanda and Nancy.
I'm going to have all day.
Do what?
Best meeting, hands down, I'm going to have all day long.
Yay!
Literally,
So
he's
fun to
so
listen to.
sweet.
As in, he's fun. And I didn't want to sound like a huge nerd, but during COVID, somehow I had heard or maybe I read one of his blogs that he had written a book. And I'm a huge nerd. I like to write too. So I did buy his book, his fiction book, Code Blue, but I haven't read it because you guys know I have ADHD and it's hard for me to read. I think everyone knows there was one book I had probably started during COVID that I just finished. So, but yeah, I didn't want to sound like a huge super fan, oh, I have it on my shelf, but I do. So I need to read it. Thought that was pretty cool. Well, good. I hope you guys enjoyed that. This was really all set up by Josh. He had reached out and unfortunately had a little bit of an emergency this morning, so he was pretty bummed. But I told him we're recording it, so you can still watch it and pretend like you were there. So I do want to just do a quick screenshot. We're wearing blue. I thought, Amanda and Nancy, you guys can stay if you want or not, but we're just going to do a little picture and kind of put thanks for all you do.
I didn't get the memo. I'm in white. I'm gonna bounce.
Well, I did kind of invite you late, so you're totally fine.
Bye, guys. Thank you.
Bye, Amanda. All right, let's do a screenshot. Roxanne will be sending out her Go Stars message in the background. I love it. I will know there were a lot of us are from Texas. What am I? Sorry, guys, I don't know what I'm doing. Okay, let me just do snip tool. Okay, you ready, everybody? I'm just kidding. Big smile. Let's say you ready. Oh, there you go. Okay. 1, 2. Look at the camera. 3. All right. I think we're good. All right. Everybody's looking decent. Not crazy. In case this goes out to somebody else's blog. Okay. Good. All right, guys. Well, I have another call too. Thank you so much for joining us. I hope you guys enjoyed hearing from him. I always do. I'm fascinated. with what they do. So thanks again. And Josh will likely be out the rest of the day. So please ping me if you need any help with anything today. Okay.
Thank you.
Bye, guys.